Florida and Texas halting reopening plans because of large-scale virus spikes in those states. Dr. Scott Gottlieb's the former FDA Commissioner, now a CNBC contributor. Dr. Gottlieb, welcome back. It's good to see you. What is your reaction to this news now, not only from Texas, but from Florida as well?
Well, look, I think it's prudent, but Texas also announced that they were suspending elective surgeries in their hospitals. And so they're really putting the onus on the healthcare system to absorb a lot of this, because not only is the healthcare system now grappling with increased caseloads coming into those hospitals, but the hospitals are going to lose a lot of revenue because they need to suspend elective surgeries. So they didn't roll back any of the openings. They just suspended further reopenings. But restaurants right now in Texas are at 75% capacity, bars at 50% capacity, sporting events 50% capacity, rodeos 50%. Nail salons, hair salons, piercing salons, even hair loss treatment centers are at 100% without any social distancing requirements. So effectively in Texas right now, you can't get a hip replacement, but you can get hair loss treatment. And so I think what Texas needs to do, and these other states as well, but Texas is a good example, is figure out where the virus is spreading and take more targeted but aggressive steps. And so if Texas thinks that it's the bars, and we've talked about this last night as well, they think the bars are a source of spread, or a congregate setting where spread is occurring, then you take action to, either close them or dramatically curtail business in those establishments. But you don't put all the onus on the healthcare system, which is what's happening right now.
To be clear, you're saying what Texas did today does next to nothing to mitigate the spread of the virus because virtually everything in that state is already open.
That's right. They didn't do anything. They didn't intervene in a way that would do anything to put downward pressure on the spread. The spread's occurring. We don't know where it's occurring. We think it's occurring in congregate settings like bars, but it could be religious establishments. We just don't know. Most of the states open at some level of capacity, but what they did was they freed up capacity in the healthcare system to absorb the influx of patients. But by doing that, they also put additional pressure on that healthcare system because the hospitals that are already strained financially now can't do elective surgeries, and so they're going to lose resources, significant resources, as a result of that. So I would expect that you're going to see a lot of pushback from the healthcare establishment in the coming days because they can't be on the hook to absorb all the consequences of policy decisions that aren't getting made.
You think that could move the governor to actually roll back some of the reopenings if the healthcare business in the state of Texas takes more of the lead on this now?
I think what we've seen before, and we saw it in New York as well, when the providers organized and pushed back, that instigated political action. And so, I think you're going to see the same thing potentially in Texas and other states. The healthcare system, they're prepared to take care of sick patients, but they need to do it in concert with smart policy decisions that are heading towards a better outcome. And, in Texas right now, there really isn't an intervention that I see, short of the governor now encouraging mask use in outside settings. But there really hasn't been a robust policy intervention that's really going to be a brake on the continued spread. So they didn't extend the openings, but most of the states open, and whatever spread's occurring is occurring under the auspices of the policy decisions they already made. They're enforcing it a little bit better now with the bars. They've gone in, they've fined some bars. They've put in 30-day suspensions on about 17 liquor licenses and bars that weren't adhering to the distancing requirements. That's something, but it's not going to have a really profound impact. They have a lot of spread underway.
That's the state of Texas. How would you characterize what's taking place in the state of Florida tonight?
Well, it's similar. I mean, if you look at, they don't report hospitalizations, so we don't know how pressed their healthcare system's getting. Their testing is down week over week, actually. They have a lot of cases. I think in some respects, Florida might be in a more troubling situation with respect to their community spread. They have multiple hotspots right now, and they're probably not measuring it as well as Texas is. If you look at Miami, I believe Miami has almost 900 hospitalizations across Miami-Dade County, which is one of the places that reports daily hospitalizations. And so they're getting pressed as well. I mean, both Texas and Florida have a lot of healthcare capacity, so they can absorb a lot of infection, but they have mounting cases. They have community spread, and it's going to be hard to get that under control without taking some more aggressive, targeted. It doesn't need to be a statewide shutdown, but it needs to be targeted interventions. The other states I'd be very worried about right now are South Carolina, Alabama, Arkansas, small states that don't have the healthcare capacity, but have mounting infections. South Carolina and Alabama each recorded over 1,000 infections today. That's a lot on a per capita basis. You have to be very worried about those states as well, because states like California, which has a pretty big outbreak in Southern California, Texas, Florida, have very big healthcare systems. They can absorb a lot of infection, tragically, but small states can't do that, and it's hard to move patients between states.